Hey guys, welcome back to my channel, and if you're new here, my name is Stella. I create content all about my life with chronic illness and disability. I spread awareness and all that good stuff. You've seen the title, so you already know what this video is about. I'm going to talk about my EDS story and tell you a little bit about what EDS is if you don't know. And just before I start, I would really love it if you subscribe down below, click that like button, and while you're at it, just turn that bell icon on so you get notified every time I post a new video. Now, without further ado, let's get into the video. So EDS stands for Ehlers-Danlos syndrome. EDS, or Ehlers-Danlos syndrome, is a group of rare hereditary connective tissue disorders. Now, as far as we know, there's about 15 types, but scientists reckon there is a lot more that just haven't been discovered yet. Now, when you think about the body, our whole body is made up of connective tissue, our skin, our bones, our organs. So our whole body is connective tissue. It's what holds everything together. It's what keeps us alive, what keeps us breathing and moving. So connective tissue is super important. It is held together by something called collagen. If you think about collagen, it is like a type of mechanism, shall I say, but this is how I like to demonstrate it. So I've got this fidget toy that I just really love to play with, and if I twist it, generally collagen is all twisted up like this, and this is what it should look like. But because we have muscles and a heart and lungs that need to move, it needs to be a little bit elastic and a little bit flexible. So most people's collagen will look like this, nice and tight with a little bit of flexibility. In somebody with EDS, me, Ehlers-Danlos syndrome, my collagen and my connective tissue is not tight like this. It is more described like taffy or gum, whereas a regular person's collagen is described as elastic. So in somebody with EDS, our collagen is not nice and tight like this. It's very loose. So it is more like this. And you can see there's way too much movement in it. So what does that mean for somebody with EDS? I make a joke and I say this to my husband. This is me. Anyway, you get the idea, right? So where our joints are super loose, our muscles are super loose, a lot of us will be really, really flexible, but it's not a good type of flexibility. We get things like joint dislocations or joint subluxations, which is partial joint dislocations. So you can imagine how painful that is. Like mine happen multiple times a day and it is super painful. We also have organ problems, like you probably know if you've watched my cardiology series, I have problems with my heart. I actually have heart block, but I will do a different video all about that. We have a lot of problems with our bones. A lot of us have really stretchy skin. Mine isn't super stretchy, but you can see here, I have a lot of excess skin. For somebody of my sort of weight and height. A lot of people with EDS also have things like dysautonomia, postural orthostatic tachycardia syndrome, POTS, which I've spoken about before. A lot of us have problems with food, like being able to digest stuff, allergies, joint dislocations, as I've mentioned, but I'll put up a list here of symptoms because I automatically think of my symptoms. And we're all different. EDS affects us differently, same way with any condition really. That is why I use a wheelchair and crutches. I've got my crutches right here because any sort of pressure I put onto my joints, my knees will dislocate, my ankle will dislocate. There's a high level of pain involved. When I sleep, something pops out of place, but my EDS is known as Hypermobile EDS or the hypermobile type. Now, that's a bit up for discussion. We're not 100% sure. When you get diagnosed with EDS, it is done on a clinical basis. There is no blood test that can identify it. There's no such MRI or anything like that that can really identify EDS. It's more about your history, a series of events, and an examination that they do in person. It is not clear cut or straightforward. The average person, if I remember correctly, it takes about 10 years for the average person to get diagnosed with EDS. Mine was 14 years altogether. It takes a very long time. It is a really difficult thing to diagnose, and it can be invisible to a lot of people. There really isn't a lot of doctors who understand it or know about it. I mean, there's still so many doctors that I've spoken to that have no idea what it is. They know what hypermobility is, which is not the same as Ehlers-Danlos syndrome. And one of my pet peeves is when people get it mixed up, and I say to people like, I'm hypermobile, and they go, oh, lucky you, that's so lucky. And I'm like, yeah, I'm so lucky my wrists dislocate. I'm so lucky that I have to use a wheelchair and crutches. People just don't understand. And this is one of the reasons why I started my channel and why I'm talking about it. Just to add, you can do some testing, which is known as genetic testing. So if you have one of the rarer types of EDS, for example, the vascular type, which is a potential type of EDS that I may have, you will find that there are genes missing. So you'll have a missing collagen or a missing protein in your testing. So you'd often go to a genetic counselor for that. It's a process. It really is. Like disability, chronic illness is such a process. It can be a really traumatic thing. So if you are somebody who thinks you might have EDS, or you know somebody who thinks they have EDS, just like persevere. There will be help out there eventually. It just takes so much time. It takes a really long time. I've been on this journey for such a long time and I still don't have all my answers. But anyway, with all of that said, let's get into my story with EDS. EDS is something you're born with. It's not something you develop later on in life. It's actually something you're born with. It's hereditary. Some people's EDS can be really mild, so it just affects them a little bit. Some people's EDS is really severe, like mine. It all depends. A lot of the time, what happens in most people, when they're younger, they'll have a few symptoms here and there that are a little bit problematic, but as they get older, the problems get worse and worse. And then with time, you either get your diagnosis or you get misdiagnosed, which happens to a lot of people, including myself, until you eventually find the right person who will go, that's EDS. So when I was younger, I used to get really tired a lot. I would always have aches and pains, and I'm talking about from a really young age, like 6 years old, 8 years old. I was always tired, always in a lot of pain. And I really shouldn't have been, because my parents always kept us active. I did running, I was really into athletics. I was never that good at it, but I used to like long distance running, but it just caused me really bad shin splints. I was always in pain. I could never really recover. With EDS, recovery is really, really hard. It takes like double or triple the time of a person without EDS. My joints will always pop and crack. And then when I was at school, I used to cry at school because I couldn't keep up with the other kids. If I look to like my college years and my uni years, things that I was really good at was textile design. I actually worked in fashion for a little while. I was really good at it, but it was really demanding. And like most university students, I had to work. I just couldn't do it. It got to the point where I wasn't sleeping, because EDS really messes up with your sleep. And there were nights where I wasn't sleeping like 2 days in a row. Wake up, go to uni, finish uni, go straight to work, come home, do my uni work, not sleep, and then just go to uni. And then on the rare occasion when I did sleep, it was like 2 hours. And I was exhausted all the time. And so I started to get depressed because I felt like a complete failure. Why are other people able to do the work? Yeah, sure, they're tired because it's a big workload, but other people are working. Other people are having jobs while studying. Why can't I do it? If I think back to my college days, and even earlier, I always had problems with food. So when I say problems, I mean allergies and sensitivities. So my mum always said I was never able to have cow's milk because I would always be sick. So I was not able to have cow's milk as early as they could remember. I'm Bulgarian, so we have a Mediterranean diet, and I was not able to have things like eggs, fish, a lot of the meats that they have, a lot of vegetables. They like to have a lot of night vegetables in Mediterranean cooking, things like aubergines, courgettes, tomatoes. I used to have really bad troubles with those, and I'd be sick, toilet problems, or I'd get this pain that goes through my nervous system and I'd be like paralyzed. It was really bad. Nobody really understood it, and you would just kind of eat what you were given. And I just stopped eating because everything was making me ill. And it wasn't that I didn't want to eat. I wanted to eat. It's just everything was making me ill. So I started not eating. With that, I started to lose a lot of weight. Anyway, I went to my doctor and he diagnosed me with anorexia and depression. I was placed on a program at the Maudsley where I would go there for a year. The whole point was for me to gain weight, but even myself at the time, I didn't realize that it was the fact that I had all these allergies and sensitivities that I stopped eating food. It kind of got to the point where it became normal that I started to think it was an eating disorder because that's what I was told. I had a lot of therapy, and at one point I had people come into my house to check on me to make sure I was eating and taking my meds and stuff like that. When I started to eat again, I started to get the problems again. I was like being sick, feeling dizzy, getting all that nerve pain and stuff like that. With that, I would be sick, and then they thought it had turned into bulimia. And that was really hard because it was just like not being believed, just like trying your best to do whatever you can that's right by your body and not being believed. It went from being diagnosed with anorexia to then being diagnosed with bulimia, being on antidepressants, and I just wasn't getting better. Like, I started eating more, but then I started to get more ill. And after about a year, which by the way, all of this messed with my uni so bad that I had to drop out at the last year, and I just couldn't cope with uni at all. I had to keep going to these sessions, which were I think 3 times a week at one point, plus people would come visit me. Anyway, I thought, well, I'm gonna try and work because I need money. I'm not at uni, I'm not getting a student loan, I'm not doing my part-time job, I need to get a full-time job. And while I was looking for a job, I was literally selling everything I had on eBay. That's how I was making money, like my dresses, my outfits, my shoes, everything. And obviously that wouldn't be something I could do long term because eventually you run out of stuff to sell. But that's what I was doing until I got a job. Now, eventually I landed a job working as a library assistant in a library. When I applied, I didn't say I was disabled because I didn't know I was disabled, but they had moved me from the Maudsley, which is where I was getting my treatment initially, to now St. Thomas's Hospital that deals with more specialised techniques. Anyway, so they knew that I had to not be at work for certain days or certain hours because I had to go to these programs where I would do these therapy sessions and classes to get me feeling better. While I was at work, it was actually a very physical job because we had to stand a lot, do things like check out books, help people with information. We were not allowed to sit. In fact, part of our job was to stand all day, and the only time you could sit is if you had office work, which I often wasn't because I wasn't higher up in the ranks. It was usually like the librarians, but I tried to do whatever I could to get myself higher up and learn more so that I could go into the office more often, even though I loved socializing and talking to people, but it was just really hard for me. So now I know that I have POTS, but I didn't know back then. So when I would stand for long periods of time, I would feel dizzy or faint. And a lot of the times I used to have to sit down, sit on the floor to tidy books away, because that's how I would sit down, because I knew if I didn't sit down, I was going to pass out. In the children's library, the shelves are lower, and I'd get one of those kids' chairs. I was like stacking the books away in the children's library just so I could sit down and not faint. There were multiple times where I would get told off for sitting down, but if I didn't sit down, I would faint. So that's the first thing. I assumed it was anxiety or depression because that's what my therapists and my doctors told me. And then I started to develop chest and heart pain. And then when I went to my doctors, they also told me that was anxiety and depression. So I was just like, wow, I'm so depressed. Like, I didn't know my anxiety and depression could be this bad. I wanted to do something to keep myself active and take my mind off of all these things. And so I would go to the gym a lot, but then when I would go to the gym, I wouldn't recover. And then the next day I couldn't be fit for work. And then it got to the point where I couldn't wake up for work. And it was just kind of the same thing that was happening at university, but happening at work. And I was like, oh no, this is happening again. So it got to the point where I was literally just waking up, going to work, coming home, going to sleep. Waking up, going to work, coming home, going to sleep. I wasn't having dinner. I wasn't having lunch at work. Sometimes because my colleagues would ask questions, I would like make little salads or have little bars because I knew that could be something my stomach could handle that wouldn't make me throw up at work. But if you have EDS and you have either gastroparesis or mast cell activation syndrome or anything like that, you know exactly what I'm talking about. It's really difficult to eat. So I started to go trampolining. I got pretty good at it and I quite liked it because rather than lifting physical weights, you're doing gymnastic, artistic type things, and I really liked it. And one of the days I went too high or something and I fell off the trampoline. I had to stop doing trampolining because when I had my x-ray, it turned out that I actually had a knee dislocation and I had sprained my foot. And I had to be out for 6 months. Now I started to try and find other things, which eventually became yoga. And I did yoga at my local gym, and I still do yoga to this day, and I highly recommend it to anyone with chronic illness or disability. I do yoga on Instagram. You can check out my Instagram. I do wheelchair yoga, seated yoga. I had this goal that I wanted to learn how to do the splits, and there was no gymnastics club. So I said to myself, I'm gonna learn how to do the splits, and it took me 2 weeks. Maybe 2 weeks is a reasonable amount of time, but I am in the yoga community where I know people have practiced for years and they can't get the splits and they stretch on a daily basis. And I said to myself, I'm going to learn how to do the splits, and I did it in 2 weeks. Now that's not normal for most people. And then since that one knee dislocation, I started to get muscle soreness, migraines, dizziness, just fainting all the time. Obviously there's lots of things that have happened in between, but it got to the point where my work was like, Stella, you're not fit for work anymore. They basically said to me, if I don't leave, they're gonna fire me. So that was the ultimatum I was given. I don't think something like that would ever be able to happen in this day and age, but this was back in 2014 now. This was after I had already gone part-time because I figured if I try going part-time, maybe that would help. And believe me, I was good at my job. I was so good with the public. People used to come in just to see me. I was excellent at reading books to the kids. I love talking to people. One of the reasons why I'm doing YouTube is because I love talking to people and I love socializing, but being chronically ill, I can't go out that much. So how do I interact with people? Through social media. I'm sure a lot of people feel that way in this day and age that we're in with the panini. That was kind of like a big eye-opener for me because I was just like, wow, I'm being fired from my job. If I don't leave, they're gonna fire me. That doesn't look good for me. I had developed a limp, which I thought was an injury because I would do a lot of walking around, but in hindsight, knowing now, it wasn't. It was my EDS. I went to my GP and he was like, it's just an injury, rest, ice, compress. 6 weeks had gone by, I didn't get better. Went to A&E, they were like, looks like an injury, rest, ice, compress. A year went by and I was no longer able to walk. I started needing to use crutches. That was quite hard for me because I had gone from somebody who was really independent, working, able to make my own money, active as much as I could be, doing yoga, going out, seeing friends, to being completely housebound and being completely dependent on my husband. It was just a really traumatic time, and as far as I knew, all I had was depression. It got to the point where I was bedbound. Chris had to look after me completely, and he still does. I saw a rheumatologist privately because I wasn't really getting anywhere with the NHS. They just kept telling me I'm depressed, I'm anxious. And I just knew it was so much more. There was no way that depression and anxiety was going to make me need to use crutches and my joints dislocate. So I went and saw a rheumatologist privately. He suspected I have an autoimmune disease, which I do have lupus, but at the time, my tests all came back negative. So we know now it was a false negative, but at the time when I took the autoimmune tests, they were all negative. So I was like, what is going on? Like, is this all in my head? Because that's what everyone kept telling me. It's like all in my head. Like, you're too young to have these problems. There's no way somebody like you could be tired all the time and all these things. And I'd moved in with my husband's parents, which at the time he was my boyfriend, because it was closer to work. And I thought, well, that might make things easier for me to get to work. Thinking back now, I don't even know how I got through it. All weekend I was in bed sleeping. Like, my weekends were recovery. That's what my weekends were. I didn't go out on the weekends like other people my age. I was recovering. But anyway, so after I'd done all those tests, everything came back negative. And he was like, I don't really know where to go from here. It looks like you just have anxiety and depression. And I was like, oh, not this again. Like, I just knew it was something more. I went home, I told my mom, and then she was like, I have a friend whose son tested positive for Lyme disease, and the symptoms he has are very similar to yours. And I was like, what's Lyme disease? I looked it up and I was like, oh my God, this is what I have. So I went back to the rheumatologist and I said, please, can you give me a Lyme disease test? He was like, it doesn't exist in England. To get Lyme, you should have been to America. Have you been hiking in America? Did you ever get a bullseye rash? I was like, no. And he was like, well, then you don't have Lyme disease. And I was like, please, we're going to pay for it. And it came back positive. And I was just like, oh my God, I've got Lyme disease. He put me on a month-long doxycycline. And after a month, it didn't work. And he was like, that's all I can do for you. There's nothing else I can do for you. My husband found a book called The Lyme Solution by a doctor called Dr. Darren Ingalls in California. And this was after we'd searched the length and breadth of the UK trying to find somebody who understands Lyme disease. I know this story is about EDS, but it is connected. That's why I'm mentioning it. So I got onto a Zoom call with this doctor in California who had agreed to see me. I'd sent over my test results. He asked me a bunch of questions and he was like, I have no doubt you have Lyme disease. And he was explaining to me how it's really difficult to catch when you're in the late stage. I was lucky it came back positive because most people in the later stage, it comes back negative. And he put me on this long list of herbal medications. Like, my box was huge. I'll insert it or something so you can see. The problem was, because I have mast cell activation syndrome, which is caused by EDS, I was unable to stomach them. They were making me so sick, which I thought was a Herxheimer-Herx reaction, which, if you don't know, a Herxheimer reaction is a die-off from the Lyme disease once you start treatment. It probably was a mixture of that, but I was also really allergic to these meds I was taking. And so after a month, I had to stop taking them because I just couldn't. I was getting worse. So I spoke to him again and I said, is there anyone you know, like in the UK? And then he gave me the details of a clinic called Breakspear in Hertfordshire in the UK. That is a good 2.5 hours away from where I live, but I was so desperate. I was willing to do anything to go. I met my Lyme literate doctor. She helped me immensely. I had a bunch of tests done and I'm talking everything. Lyme, co-infections, mast cell activation syndrome, which I now know is positive. A bunch of sensitivity, so I know I've got chemical sensitivity, mold toxicity. I tested positive for that. Parasites, which I tested positive for. I also had glandular fever. I had chronic mono, which I still have. It comes back every now and again because it's chronic. I do get a lot of infections and things like that. My glands are always swollen, which is partially from lupus. And I'd gone on Lyme treatment for about 2 years. As I started seeing improvements for the Lyme stuff, the EDS stuff started to get worse. So my joints went from dislocating and subluxing every now and again to happening every day, and now multiple times a day. And it got to the point where it was just like, even if I was sitting on the sofa, it would dislocate. It's still like that, but now I obviously use knee supports. I use a wheelchair now, not just crutches. I know that when I get up, I shouldn't twist. I have to walk a certain way and things like that, which are all preventative methods. I've also had physio and whatnot. So in a sense, I am better, but it's not healed or cured by any means because there is no cure for EDS. I got lucky in the fact that my Lyme literate doctor actually has EDS. And she was looking at me and she was like, I want to test you for EDS. And I was like, what is that? And then she did a bunch of tests on me. So one of the things is you can touch your thumb to your wrist like this. I can do it very easily on both sides. And that's one of the diagnostic criteria. So you get a point for each side. The other one is, can you bend your fingers back more than 90 degrees? Yes, I can, on absolutely all of them. If I show you my feet, they're super floppy. Me and Chris used to laugh at this when I was younger. My feet are super flexible. I have no idea why, but they always have been. You shouldn't be able to do this with your feet. Sorry, that was too much for information. Like I showed you, I have excess skin, so I'm pretty slim, but I have a lot of skin here that I shouldn't have. Usually people have this when they've lost a bunch of weight. Me, no, I have just so much excess skin. As I showed you here in my arms as well. For the longest time I thought this was fat. No, it's skin, my doctor told me. And so she knew I couldn't stomach a bunch of medications because while I was on Lyme treatment, we constantly had to keep changing my Lyme treatment because I would just become intolerant to it. I tested positive for mast cell activation syndrome. She was like, you have EDS. And I was like, what's that? And then she told me about it and she was like, this is what you've been dealing with all along. And the fact that my immune system was really weak, that's why I caught Lyme disease. So I got to the diagnosis of EDS in a really roundabout way, because if I hadn't gotten Lyme disease and I hadn't seen that doctor, I would have never, ever, ever been diagnosed with EDS. But she's not an EDS specialist, but because she has it herself, she told me all these things that I needed to do. We wrote back to that rheumatologist. He said to me, like, it's such a rare thing, we never look out for it. I would have never in a million years would have think you had EDS given how you look, which is a whole issue in itself. I started to develop thoracic symptoms, which is sort of like the back of the neck and the side of your back. I started to get sciatica. And so my Lyme literate doctor put me through to get an upright MRI, which is an MRI upright. Your head is stuck here and they do an MRI to check your neck and the stability of it. Thankfully, I don't have cranial instability, but I am prone to it, so I need to go and get that test done every few years just to make sure it doesn't develop, because she now has it and she got it at the age of like 38 or something, so there's always the potential I could develop it, but thankfully I don't have it. I had a herniated neck, which was just like a slight bit of the disc came out. With a neck brace and stuff, it did heal on its own and it wasn't serious, which was really good, but just the fact that it did that and I didn't know is a bit weird. But you know, that's EDS. Like when I eat, my hands are so flexible, my fingers as well. I find it really hard to eat with forks and stuff, so like I flick food around, it's really weird. My jaw is really loose, so you can see it's like coming out. Not sure if you can hear that, I shouldn't be doing that. But when I sleep, my jaw pops in and out. When I eat, it's really hard to chew. I'm now on a diet plan of foods I can eat. My shoulders dislocate all the time. My knees dislocate all the time. I've got issues with my heart, as I mentioned earlier. Yeah, and my shoulders popped out. Oh, I'm trying to click it back. Anyway, in the recent ECG, my heart stopped for almost 5 seconds. Now anything above 2 seconds is known as a medical emergency. Mine stopped for 4.75 seconds. One of the things we're worried about is my granddad had a lot of organ problems And he was also really flexible because apparently he was a dancer. One day he had a heart attack and died, and he was in his early 40s. They knew he had organ problems and that he was ill, the doctors, but they didn't know why. His cause of death was just heart attack. Potentially he had the vascular type, potentially, I don't know for sure. Particularly focused on the heart, and it is a very rare type because it usually ends with the person having a fatality in their 30s or 40s. Sometimes you can live up to the age of 50. The problem with EDS is if you don't have genetic testing, which a lot of places don't do genetic testing, it's very specialized, it's very expensive, and it's so rare that a lot of places just don't even do it. If you don't have genetic testing, you are immediately put into the hypermobile type. That can be really dangerous because there's a lot of people who think that they're okay or seemingly managing their symptoms, and then they just, you know, I'm a very positive person. I enjoy documenting my journey. When somebody tells me something now, after everything I've been through, if I know that that's not what's going on with me, I will tell the doctor straight, because more times than not, they will tell you it is in your head. I now know that all my issues were either caused by EDS, were EDS, or are comorbidities of EDS. But it's hard. There's a lot of pain involved, a lot of physio involved. My husband is essentially my husband, my best friend, and my carer. If you know you're going through something and doctors, professionals, family, anyone tells you you're making it up, you know yourself better than them. Keep advocating for yourself. If you've made it all the way to the end of this video, thank you so much for watching. Thank you for being here. Please like this video if you found it helpful or useful. I'm going to say goodbye. Click the bell icon to get notified every time I post. And thanks for watching. Thanks for being here. I'll see you in the next one.